You wake up feeling terrible, head pounding, throat on fire, body aching like you slept on concrete, nose running like it has somewhere important to be. What do? You grab your phone, Google your symptoms, immediately conclude you have 17 different diseases. Then drag yourself to a pharmacy, buy 17 different medicines, take 2 of them, and feel better in 3 days. Easy, annoying, but easy. Now imagine doing all of that with absolutely none of those options. No phone, no woo-woo, no pharmacy, no medicine, no doctor, no hospital, not even a thermometer to tell you how bad things actually are. Just you, your body, and whatever is currently destroying it from the inside. That was the reality for ancient humans every single time they got sick. And here's the wild part. They survived anyway. Let's talk about how. First, let's understand what getting sick actually meant in the prehistoric world. Because it wasn't just uncomfortable. It was genuinely terrifying. A modern fever of 39 degrees sends us to bed with Netflix and a sports drink. For an ancient human, that same fever with no treatment, no fluids readily available, no way to reduce the temperature, could spiral into organ failure within days. A tooth infection today means a dentist appointment and some antibiotics. For an ancient human, that same infection could spread to the jaw, then the skull, then the brain. Death from a toothache was genuinely common. Even a broken bone, something we fix with an x-ray and a cast, was potentially a death sentence. Not from the break itself, but from the infection that followed. From inability to hunt or gather food while immobile. From being a burden on a group that needed everyone contributing just to survive. Getting sick in the ancient world wasn't just a health problem. It was a survival crisis. So what did they actually do about it? More than you'd expect. Way more. Here's where ancient humans genuinely surprise you. Plants first. Archaeological evidence shows that medicinal plant use goes back at least 60,000 years. A Neanderthal burial site in Iraq, Shanidar Cave, contained pollen from 8 different plant species, several of which are still used in herbal medicine today. Whether those plants were placed intentionally as medicine or as ritual is debated. But what isn't debated is this. Ancient humans were paying close attention to which plants made them feel better. And they remembered. And they taught each other. This is actually the origin of medicine. Not laboratories. Not doctors. Just humans noticing, every time I eat this leaf when my stomach hurts, the pain goes away. Then telling the next person. Then the next. Rest and community. Studies of modern hunter-gatherer societies show something remarkable. Sick individuals are consistently cared for by the group. Food is brought to them. They're kept warm. They're not abandoned. This matters enormously because rest and warmth and hydration are actually the 3 most important things your body needs to fight infection. Even today, ancient humans didn't know the science, but they figured out the outcome. Wounds and injuries. Evidence of prehistoric surgery is genuinely shocking. Skulls have been found with clean holes drilled into them, a procedure called trepanation, and crucially the bone shows signs of healing around those holes, meaning the patient survived, meaning ancient humans were performing brain surgery, successfully, tens of thousands of years ago. But let's be honest about the other side of this. Because for every ancient human who survived illness through plant medicine and community care, there were many who simply didn't. Child mortality in prehistoric populations was devastating. Estimates suggest that somewhere between 40 and 50% of children died before reaching adulthood. Not from violence, not from predators, mostly from illness and infection that today would be treated with a single course of antibiotics costing less than a cup of coffee. Parasites were an almost universal feature of ancient human life. Intestinal worms, skin parasites, blood parasites, carried by water, by food, by insects. Constantly present, constantly draining energy, constantly shortening lives. And mental illness, which we now understand as a medical condition requiring treatment, was completely invisible to ancient humans as a category. Someone experiencing severe depression, psychosis, or epilepsy wasn't seen as sick in any way we'd recognize. They were frightening. They were mysterious. The explanations were spiritual. The treatments were rituals. Sometimes those rituals helped because belief and community support genuinely do affect recovery. Sometimes they didn't, and there was no way to know the difference. Here's what sits with me after all of this. Ancient humans were working with almost nothing. No understanding of germ theory. No concept of bacteria or viruses. No way to see what was actually making them sick. And yet, they developed herbal remedies that modern pharmacology has confirmed actually work. They performed surgical procedures that required planning, tools, and genuine skill. They built systems of community care that kept sick people alive long enough to recover. They didn't have medicine, but they had something that medicine still can't fully replicate. They had each other. Every time someone in that tribe got sick, the group didn't calculate whether it was worth helping. There was no insurance claim, no medical bill, No question of whether this person deserved care. They just helped. Because that's what you do when someone is suffering and you have the ability to ease it even slightly. That instinct to care for the sick, to sit with the suffering, to bring food to someone who cannot feed themselves, that instinct is not modern. That instinct is 200,000 years old. And the next time you check on a friend who isn't feeling well, or bring soup to someone who's sick, or just send a message saying, hey, are you okay? You're doing exactly what your ancestors did. Around a fire, in a cave, with no medicine and no guarantees. Just the simple human decision to show up for each other. Some things don't need to evolve. They were already perfect. Hope you found the answer to how your ancestors survived illness. With no medicine, no doctors, and nothing but plants, each other, and sheer human stubbornness. For more such fascinating ancient human stories, subscribe to Cuckai. Previous video link is in the description. Until next time, goodbye.